India's healthcare sector has emerged as one of the largest industries and an important pillar of the country's landscape. Talking to us today is a dynamic leader of the healthcare sector, Dr. Abel George, CEO of St. Isabel Hospital, Chennai. Prior to this, he was working with Apollo Hospitals, Chennai, as a senior manager in medical administration. He worked closely with the top management of Chennai cluster and led cost optimization projects, medical strategy, and service excellence initiatives along with the COO. Dr. George is proficient in leading small and large teams, budgeting, P&L, and cost optimization and team building. His strengths are operational strategies and taking up key turnover round projects. Thank you, Mr. George, for taking out the time and interacting with Brickwork Ratings.
Thank you. It's my pleasure, Tina.
Right. So today, on today's segment, we throw light on the healthcare sector. So let's hear what are the hits, the misses, and the opportunities that this sector has to offer to us. So on the onset, I would like to ask you, what is your outlook for the healthcare sector in 2022? Is it an attractive sector or in a difficult year?
Yeah, so if you ask me, I have a very positive outlook as far as the healthcare sector is concerned in 2022. So there are some reasons when I say that I have a positive outlook. So one of the major reasons is we kind of moving out of the pandemic. I would not say that we are fully out of the pandemic yet, but then at least we believe that the worst is over unless another major wave hits us. But then a lot of people are getting vaccinated. There's a lot of herd immunity building up. So even if you see, like, we had a wave a couple of months back, but then if you compare the mortalities and the hospitalizations, specifically with COVID, it was much, much less as compared to the first and the second wave. So things are getting back to normal, or if I would put it, we are actually in a new normal, right? So a new normal has been created. So that is very exciting. And earlier, when you used to say healthcare, at least before the pandemic, it always mostly used to mean like hospitals, the first thing that comes to your mind when you say healthcare is hospitals, right? But then the pandemic has taught us one important thing, that, healthcare cannot be just limited to hospitals. It's in fact a very wide ecosystem, right? So things like home care, digital health, health technology, insurance, elder care, all of this has gained a lot of prominence with the pandemic, and that's something that has taught us, and that has its own advantages and it has its disadvantages also. But then it's exciting because we get to venture out into newer fields, newer pastures which were previously unexplored. And even when you talk about the entire healthcare sector, for example, in 2022 alone, we have had a lot of big news floating around. So if you talk about hospitals, for example, the acquisition of Columbia Group of Hospitals by Manipal, which was like one of the biggest mergers and acquisitions ever. And if you talk about the digital healthcare space, the merger of M-Fine with LifeCell, raising $80 million. So that was also a big. So wherever you take, and you take all of the big technology companies like Amazon, Google, so Apple, so they are also investing into healthcare in a very wide extent. So I would say the outlook is very, very positive. And to just give you some kind of figures, for example, if you see the merger and acquisition that has taken place in healthcare in the first half of 2022, we have crossed $4.32 billion, which is more than what was it completely for the previous financial year. So we are just at the half of this financial year, and we've already crossed more than what was for the entire financial year. So that is the kind of outlook, that is the kind of the bullish outlook that the healthcare sector has as an overall, if you ask me about the healthcare sector.
To, like, if I look at a burgeoning population of about 1.3 billion people in India, is this sector facing challenges? Because you did mention about there are certain setbacks to this sector. Yeah. So do you foresee any challenges to this?
Yes. So as I said, there are certain challenges. So one of the major challenges, if you would notice the investments in healthcare, most of it is, concentrated to tier 1 and tier 2 cities, right? So when you have, more than a significant part of your population living below poverty line. So that's around 20 to 25 percentage of your population below poverty line, and around 60 percentage of India still lives in villages. Most of your healthcare expansion, most of your healthcare investments is concentrated to a few tier 1 and tier 2 cities. So it's actually, you can actually name it. So it could be Delhi, Chennai, Bangalore, then certain tier 2 cities like Hyderabad, Vijayawada. So it's very minuscule. So the investments are concentrated in a very minuscule population. So that is where your major problem is, because your vast majority of population does not benefit with all of this. And it soon becomes a crowded market where there is increasing competition and where there are too many players vying for too lesser space, right? So that I think would be the major challenge as far as the investments or the healthcare sector is concerned. So I would put it as accessibility and service delivery and sustainability, because but the in kind of investments that is in healthcare is not small. These are mega investments. So sustaining those investments, when you enter into a crowded market, the pie that you vie for is very small, because everyone wants a share of the pie, right? So unless and until we spread, or the healthcare investments or the companies or the organizations which are actively involved in the healthcare space spread out their wings and try and include, or even try at least to develop the tier 2 and tier 3 cities, this is not a sustainable model. And again, so a similar link to it is accessibility. So if you do not sustain, your accessibility is eventually affected, right? And third is service delivery. So with all of this, there's a lot of expectation from patients. So when you nowadays we even call patients as clients, right? So a client like me or a client like you has a lot of expectation when you give money or when you spend money. So living up to those expectations are equally demanding. So that is where, if you see certain some of these recent mergers and acquisitions which I told you earlier, like for example Columbia, which was such a big chain in itself, which was known for its service delivery. M-Fine, which was at one point of time one of the biggest digital health tech platforms, could not sustain what they had started out. So because it became a very crowded market and the big players eventually outshone the smaller ones. So that is the one thing that I would want to point out in this context.
Yes, very rightly said. I think the accessibility, the sustainability, and as well as the service delivery model. Coming to, you mentioned that we're coming out of the pandemic. So, giving a contrast between a pre and a post pandemic, have you witnessed a change in the revenue streams?
Oh, yes, definitely. So when I talk about the revenue streams pre and post pandemic, so most of the healthcare organizations, specifically hospitals, have almost come to, pre-pandemic levels of occupancy and levels of outpatients. But then what is interesting is there has been a lot of emergence of revenue streams which were minuscule as compared to the pre-pandemic level. One of them being the home care. So home care in itself has emerged as a major revenue stream. So when I talk about home care, it itself is a very big ecosystem. So it can have your home lab sample collections, your home doctor consultations, which can again be virtual, or which can even be a physician on call, right? Home physiotherapy, and even home x-rays for that matter. So partly because of the fear that patients have to go to the hospital, thinking that if they go to a hospital they might end up getting COVID or they might end up getting sick. So that is where home healthcare has become a major revenue stream. Second one is the emergence of health checks. So your health checks were always there pre-pandemic also, but then the number of health checks has increased manifold, because one thing that the pandemic has taught us is to take care of us and take care of our bodies. So periodic health checks. So even when earlier also doctors used to stress on the the importance of getting periodic checks and periodic health checks, but then we never used to give much importance to it. But then with the pandemic, one of the major things that we have realized is we have to take care of ourselves and we need to have this periodic health check. So health checks has become a very important revenue stream. In fact, to give you some perspective, in the previous organization that I was working with, for example, pre-pandemic, we used to see health checks of around, say, 20-25 in a day, which has presently gone up to more than 50 to 60 in a day. So that's the kind of scale up as far as health checks is concerned. And yeah, and similarly, when you talk about home care, one of the other important factors that has grown manifold or a new concept is basically something known as a home ICU. So patients do not want to be in the hospital. So there are organizations like, for example, Critical Care Unified, which kind of sets up an entire ICU setup at home. So this is advantages for the patient and for the hospital in the sense that, hospitals can, so the beds do not get occupied unnecessarily, and the patient gets all the care that they would otherwise get in a hospital within the confines or within the comfort of their home. So there are some of these revenue streams which have grown significantly post pandemic, which were there earlier, but then their significance has multiplied and they have a larger share of the pie as compared to the pre-pandemic.
Right, that's really interesting to learn about the revenue streams, which are something new after the pandemic. Coming to the spending trends, do you see it as a favorable or unfavorable trend in terms of spending in healthcare?
Yeah, so if you remember that what I said earlier, that most of the investments is kind of focused on Tier 1 and Tier 2 cities. So wherein 60% of the population is basically uncovered or untouched, or very little significance is given to that population. So Niti Aayog last year had released a report in the by the name of India's missing middle states. Okay, so what it states is that the middle 30%, okay, so that is maybe around 35 crore of the population is without a health insurance. Okay, the bottom 50% is kind of covered by the Ayushman Bharat. The top 20%, okay, the 20% of the population, which is again mostly confined to urban cities, have their own private insurance schemes and social security schemes and all of that. So but then if you take the bottom 50 percentage and the middle 30 percentage, that comes to around 80 percentage. So if I put it this way, so almost 80 percentage of the population still has a significant out of pocket expenditure as far as healthcare is concerned, right? And that is a very significant catastrophic expense. So once you get hospitalized, even for a minor illness like a fever, you will end up spending a couple of thousands out of your pocket. So that is where this healthcare spending is highly skewed. It basically, as far as insurance coverage is concerned, it basically covers effectively only 20%, because Ayushman Bharat, which covers 50% of the bottom rung of the population, has its own limitations. There is very limited that covers, and most of the private players, for various reasons, have not really embraced Ayushman Bharat. So that is where I would say that spending as far as healthcare is concerned is highly skewed. It has improved, but then there is definitely a lot of scope. And one of the major points that I would foresee is, unless and until government really regulates this sector, there is going to be this demarcation there, or this disparity between the urban rich and the rural poor, which directly correlates with the healthcare spending.
Coming to health data, people consider this as the new gold, in terms of having a data of the patient and the records.
Yeah.
So with the upcoming digitization through HMIS, so how is patient confidentiality and portability maintained at the same time?
Yeah. Okay, so when you talk about HMIs, there are a lot of players out there in the market right now. Earlier, it was a couple of players which you could actually count, but then there are so many players. And yes, one of the major concerns as far as HMIs is concerned is about patient privacy. Okay, so and one of the major points that I would want to stress is there needs to be a specific government regulation as far as digitized. So I think that is that would be one of the points where the Ayushman Bharat digital mission would also contribute, wherein they would have particular regulations as far as HMIS is concerned, regarding who gets the right to view what. For example, if I am an administrator and you are an administrator, and two different hospitals, and if a patient comes to my hospital and goes to your hospital, what is it that I can view of that particular patient? Do I have access to the entire records, so or is there specific sections of the patient record that can be viewed? So there needs to be a proper government regulation as far as as far as integration of different HMIS is concerned, because I believe that is a future. So it would be similar to what is practiced in US, where you have like a social security number. You key in that social security number, you get the entire details of a person, right? So, and even if a patient goes from one hospital to another hospital, which are of two different, completely different organizations, they would still be able to view the entire records of the patient, subject to certain rules and regulations. So that is where I think, as far as portability, transparency of the records, or confidentiality of the records is concerned, government should come up with very strict guidelines, because ultimately patient confidentiality is the most important aspect that needs to be considered here.
So you have emphasized on privacy and security, and that has to be regulated by the government in the future. Last but not least, I just want to know, what is your take on the industry's fundraising program? Because this sector is growing multifold. So what is the fundraising opportunities in this industry?
Yeah. So healthcare is one sector, or maybe one industry, that would always grow, because people get sicker and sicker, because they don't get healthier and healthier, even though the emphasis is otherwise. So so then that is where most of the players see an opportunity. But then the point that I would want to emphasize is, we should not consider healthcare as any other industry where you expect immediate returns, because ultimately what you are doing is you are dealing with the life of a person, right? So while our primary aim should be to ensure that each and every person is healthy, and our primary aim should be towards that, right? So so strengthening the healthcare facilities is of prime importance, and that is where all of the investments should actually focus on, because that would that would have a lot of advantages. Okay, firstly, it would divide the gap between healthcare accessibility and healthcare delivery, right? So like, for example, the kind of healthcare opportunities, or the kind of healthcare facilities that you and I can access, may not be available to someone who is who is in a tier 2 or a tier 3 city. So when you talk about healthcare investment, one of the most important things that needs to be emphasized is on the accessibility part of it. And once you ensure that accessibility is there, then you will naturally get returns, because you are eventually covering a larger area of the population. To definitely take time, but then it is a sustainable model, rather than concentrating on a few particular set of individuals, because most of the investments, if you see, focus on the urban youth, or the health and wellness, the elder care. But then there is a lot of fields which are literally untouched. Okay, for example, the area of non-communicable diseases, nutrition. So nutrition is hardly untouched. But then if you talk about India, nutrition is one of the most important factors, because malnutrition is a widespread problem all over India. So, but then we hardly touch nutrition. So when you talk about, so that is when you talk about investments, it should be in a way that, definitely it is required for the entire country to grow, to entire country to be healthy. But my point is that like any other industry, you cannot expect immediate returns, because that is where many, organizations that have had significant investments have eventually failed, because the expectation gap is significant. So that is my point here. The fundraising program is definitely required. It is important. It is welcome, but with a pinch of salt. Thank you.
Thank you so much, Dr. Abel, for taking out the time to be with us on Recog Ratings. This was a very insightful session, especially to this particular sector where there's a lot of reforms, policies, and needs at the moment in different tiers. So we will take this all into account and remember the insightful discussion that we had today. Thank you so much.
Thank you.